I am Deputy Director of the Srinath Rampal Center, Yves Remy, and today I am so pleased to welcome a special guest from Geneva, who is the WTO South African delegate to the WTO and a co-proponent of the COVID-19 TRIPS waiver proposal. His name is Dr. Mustaqeem De Gama, and we will hear so much more from him shortly. And we really look forward to hearing his in-depth thoughts on the proposal that he has co-sponsored with other WTO members, including Kenya, I believe it's India, as well as Eswatini. Right, Mustaqeem?
Yes, correct. And we've just signed up a new co-sponsor in the form of Bolivia. And of course, Pakistan also joined us a while back.
Wonderful. Well, welcome to you. And thank you so much for joining us here at the SRC. I believe this is the second time we've hosted you for this year, right?
Yeah, correct. Thanks, Jan. I think the first one was on another controversial topic, the MPIA, but nonetheless, I'm happy to be back and to share some thoughts on this very, very important initiative. And so thanks very much for the invitation.
Well, it's our pleasure to have you. Before we start talking about what I have named the COVID-19 WTO waiver issue, I thought it would be really good to start with some basics about yourself. You are, as I mentioned, the South African delegate to the WTO, and you have sort of like, I would say, ownership of quite a few issues in which you represent South Africa. One is this controversial, TRIPS waiver, but also the TRIPS agreement more generally. Can you tell our listeners a little bit about the TRIPS agreement, what it is meant to do, what it's about, before we get into the waiver discussion?
Yes, thanks, Genevieve. I will do that with pleasure. The TRIPS agreement is one of the annexed agreements to the Marrakesh agreement, which is the umbrella sort of legal instrument which brought the World Trade Organization into existence. And so it has various annexes of which the TRIPS agreement forms part. And so the main function of the TRIPS agreement is that it sets minimum standards for recognition and protection of intellectual property rights. And just a very short history, before 1995, before the TRIPS agreement entered into force, we had various types of international legal regimes dealing with intellectual property. And none of them necessarily required countries at a national level to give particular standards of protection to intellectual property rights. And so enter the TRIPS agreement, it set minimum standards of intellectual property rights, which are enforceable through the dispute settlement mechanism, something that we had also spoken about before. So in a nutshell, this is what the TRIPS agreement is and what it does. It enforces minimum standards in respect of intellectual property rights.
That's an excellent overview of the TRIPS agreement. And we know that in the past, the TRIPS agreement has come up in slightly controversial contexts, right? Those who would be following the WTO discussions from 2001 would know that there was this huge furor about whether or not the TRIPS agreement was getting in the way, in a sense, of access of those in some countries without a manufacturing capacity to get access to the HIV treatment and other sort of AIDS-related treatment. Do you want to give us a little bit of a short background about that before we get to this issue, which is another one that's potentially going to also excite some discussion and has already started exciting some discussion at the WTO?
Yes, of course, Genevieve. I think this is a really good background to the types of issues that we would have raised as proponents. But maybe just a little bit of a personal history here. In about 1995, 96, South Africa was really at the height of the HIV and AIDS pandemic, and we lost millions of citizens to this very terrible and painful disease. One of the things that we had great difficulty was to access antiretroviral treatments at affordable prices because these were subject to patent. Long story short, our government decided to take matters into its own hands by changing our national law and providing for the issuance of compulsory licenses. And so at this time, you can imagine we had our president at the helm during his first administration, President Nelson Mandela, and most of the pharmaceutical companies represented in South Africa took the government to court, essentially opposing the issuance of a compulsory license. And so this process went on until 1998, 1999. And this is really the impetus that created the spark in the World Trade Organization, because at this time the World Trade Organization had been established and had entered into a new trade round called the Doha Development Round. And so as part of the requests on the side of developing countries was to really look at the TRIPS agreement and look at issues of access. And so you're quite right in recalling that history. And at that time, we were very much at the pinnacle of the HIV and AIDS pandemic. And from that point of view, the very famous 2003 decision that was later incorporated into an amendment of the TRIPS agreement under Article 31 bis was then presented, accepted, and it took another good 17 years for us to operationalize this because only in 2017 did the amendment actually take effect. So this is a very good context to many of the issues that we raise in the waiver proposal, and we believe that many of these have not been taken care of even in light of the recognition of these TRIPS flexibilities.
Well, that's an excellent sort of background. Fast forward, let's say, from the Doha Declaration and the Public Health Declaration, let's say some 20 minus a couple, 20 years to 2020. We now have a pandemic that is upon us, has been upon us for the past 8-9 months. But there is hope on the horizon, right? The hope on the horizon is that there will be this vaccine that will be accessible to all citizens across the world, those in the developed and those in the developing countries, question mark. And I think if I may preempt you a little bit, you know, what is really animating the proposal that you and the other proponents have put to the TRIPS Council in October earlier this year in providing the legal background at the WTO or the legal context for allowing all countries at the WTO to have equal access to that vaccine and other life-saving treatment and equipment in the COVID era. I guess my question is, what are you proposing against that background that we know from the WTO TRIPS context? What is at stake here, and what are you proposing through your proposal to the TRIPS Council?
Yes, thank you, Jan. I think fundamentally the issues that we raise are issues of justice. And certainly the issue of equitable access is foremost in everyone's mind. And as you indicated, now that we do have good news on the horizon, we do have vaccines that seem to be effective. The real question is, how long do we as developing countries have to wait until we have access to these vaccines? In some recent details that has come out, it seems that 9 out of 10 people in the 70 least developed countries in the world will not have access to this vaccine until 2021. Now, certainly it is with irony that I observe the emergency use authorizations that are granted in many of the rich countries for their citizens to be vaccinated. And we also have statistics that round about 15% of the world population has secured well over 54% of the total vaccine production capacity for the next few years. And this means that anyone in the developing world who wishes to have access to a vaccine would have to wait most probably until the end of 2023 or 2024 to have access to such a vaccine. And so it's in this context that our proposal essentially comes in and suggests the following: that we suspend various types of IP around COVID-19 in order to essentially get the production levels up, have more producers of vaccines, therapeutics, also personal protective equipment, any medical equipment that would be relevant not only to the diagnosis, but also the management and treatment of COVID-19. We have also suggested that in the end, IP constitutes a substantial barrier to actually ramping up production, because at the moment, the capacity to produce is very low. And so keeping it in the hands of only a few producers will prolong the process of actually ensuring that people in the developing world get access, equitable and timely access to these vaccines. And so we are proposing that more producers who have capacity should have the right to produce vaccines, therapeutics, or any of the products that could be covered under the proposal, in order to ensure that everyone has access in the shortest possible time. And so this relates not only to patents, which is a traditional area which is covered by flexibilities, but we've also seen issues around industrial designs, the printing of valves for respirators, ventilators, and so forth, trade secrets, undisclosed information, and then also copyright that may be relevant in respect of COVID-19. And so one could think of a whole range of things that are covered here. The source code of programs, for example, access to data, access to formulas, and so forth. So really what we are trying to do is to cover all the bases to ensure that we could ramp up our ability to address COVID-19 in an automatic, secure, and collective way, and also to ensure that we have more producers that would be able to produce in order to certainly give access to those who need it.
Well, thanks for that. And obviously, my thoughts are to the Caribbean, and you and I co-authored a piece that came out in the SRC's Trading Thoughts on this. The CARICOM member states, so those who are members of the Caribbean community, have by and large made arrangements under what they call the COVAX facility, which is this coordinated effort among international stakeholders like Gavi, which is headed by the incoming, fingers crossed, Director General of the WTO, Ngozi Ojonjo Iweala, as well as some others. And the idea is that there are sort of two buckets of beneficiaries of this facility through which the manufacturing capacity that you spoke around the world would in a sense ensure that some of the vaccines are made available to members of this facility, including developing countries. So it provides for the procurement and ultimately the distribution of the vaccine to these two buckets of beneficiaries. Problem being that there are those who will have to entirely finance the vaccines that are produced, and most Caribbean countries fall within that group, as well as those who will be assisted with support, financial support in accessing the vaccine. And we have a couple, not many, but a couple of Caribbean countries, including some OECS countries, that are part of that bucket. Now, I know CARICOM leaders have expressed some disappointment that the basis on which these buckets of countries sort of were designated depends on the GDP per capita criteria, through which many of our islands are treated as middle to high income countries. And so we would never fall within the bucket of of these countries that get the concessional financing to actually get these vaccines. And this is something that we have challenged in a number of different fora. But at least when it comes to financing the health of our citizens, this is something that Caribbean states that are already heavily debt-ridden will have to prioritize. So I guess I'm giving you a very nice setup for the question, which is, in the context of having this COVAX facility where most Caribbean countries, if not all, have already signed up, what is the added value of this waiver? And in a sense, haven't Caribbean countries already done what they need to do in order to ensure that their citizens will be vaccinated whenever the time comes for the distribution to our part of the world? What is this initiative, in other words, adding to these efforts that are already underway?
Yes, thank you. Thank you, Genevieve. I think it's, you contextualized this very well. And I think from a Caribbean perspective, there are a few critical questions that would have to be posed. And firstly, would what COVAX is offering, would this be enough to ensure that the health of every, and I want to emphasize every citizen is taken care of? And unfortunately, the answer is no. And as you say, there are two buckets or two spheres. One where you have at least countries that are covered in concessional financing, and those that are self-financing. And so from that perspective, if you look at the overall numbers, and for accuracy, I have the paper in front of me. If we look at what is covered under the Act A, we see that the target, and I want to emphasize this, for COVID is to provide 2 billion vaccine doses. That's the one aspect to the world by 2021. So this is 2 billion doses, and as we see now, the most effective vaccine candidates probably have a two-dose administration protocol, which essentially means if you take those 2 billion doses and you divide them by 2, you get to 1 billion doses to cover essentially, most of the world. And so from that perspective, the idea is to cover at least 20% of your lower and middle income developing countries. By my calculation, if you have 1 billion doses available, the coverage that you really obtain is less than 11 or 12% of your population. And so even if you are a beneficiary under the COVAX, which is the vaccine arm of the Act A, the levels of vaccination required to reach herd immunity, which is something above 60%, still leaves a very high margin of the population unvaccinated. And the question then really is, who gets the vaccine first? Is it healthcare workers, the elderly, people that are more susceptible? So that's one part of it, that even though countries may have access to initial vaccinations, firstly, the level of vaccination required will be too low to cover the entire population. And so no one is safe until everyone is safe. And that's the underlying idea here, that the waiver tries to address this by enabling those countries that can produce at a higher level to do so. And our experience has been, in terms of generic producers, they usually produce at a cost which is much lower than your originators. So price is definitely an issue. And certainly the direction that COVAX and Act A is taking is that it is time bound, it's limited. So it has operation only until the end of 2021. And so the question is, with most of the vaccine capacity having been bought up by rich countries, if you only have administration of these vaccines by 2023 or 2024, what will be the impact for these countries? Firstly, countries that do not have access to the vaccine would have to revert to lockdown measures. We have seen the Caribbean region being over-reliant on tourism and the services sector. Now, what happens when you lock down the region? What happens when you lock down an economy? Well, you have various impacts. Firstly, those who are least able to weather the storm will be most affected. So you will have an increase in poverty. Governments are not able to earn their normal revenue, which means that national debt possibly increases if there are external debt holders. This has a snowball effect. And so, long story short, if countries do not have access to a vaccine, they have to continue to lock down, and lockdown modalities have a much greater impact on the poor. And so even the IMF and the World Bank had recognized that the current COVID wave will put at least 600 million people back into poverty, reversing the gains that we've steadily been making over the last decade. So from that perspective, I think countries should really take this into account. The longer you wait to get a vaccine, the more difficult it is to manage the economic and socio-economic fallout, which is related to this pandemic. So from that point of view, I think it's very important for us to read the fine print in these types of arrangements.
I mean, not to interrupt, but one of the things that people have asked me about following that short article that we put out was, well, what's going to be the economic impact? What is the overall impact on the economies of the Caribbean? And I can see from what you're saying that the potential for, this almost siloed effect, so that, those countries that are approaching the herd immunity sort of threshold will be, I would say, incentivized to ensure that their citizens don't leave to areas where there is no herd immunity or there is very little access to the vaccine, or at least make it very difficult for them to come back to the countries where the vaccine has been administered, at least in far greater numbers than in the developing world. I guess my question is, and I know we want to keep this nice and short, but the question that I have is, going back to your proposal and the mechanics of the waiver that you're suggesting, is it that to the extent we are talking about vaccines, and I know that your proposal is broader than just patents, we're also looking at copyright, industrial design, but to the extent that we are talking about these vaccines, is it that it would have to operate, your proposal, in tandem with the Article 31 bis that you suggested, as well as the existing flexibilities of the TRIPS agreement, in the sense that if you're a country that does not have your own manufacturing capacity, the sort of the way out under Article 31 bis would allow you nonetheless to be importing these generic drugs or vaccines from countries with that manufacturing capacity, because some Caribbean countries still have not implemented the amendment. We have at least three countries that have not. So in terms of the next steps, what would you need? What are the predicates or the prerequisites that Caribbean countries and other developing countries would have in place in order to give effect to the proposal that you and your proponents have put forward? What is it? What are the next steps, both internally as well as in terms of your proposal, in order to sign on effectively and take full advantage of what you're proposing?
Yes, thank you. I think that's a very good background, and I want to emphasize that the waiver proposal, recognizes the usefulness of TRIPS flexibilities. And so from that point of view, we encourage every member of the World Trade Organization to fully implement these flexibilities. This is really the starting point for our discussion. However, this is in the ideal world. What is happening on the ground? Well, as you indicate, there are many members who haven't incorporated even the 2003 decision, let alone any of the other flexibilities that exist. And so, given this particular fact, we've also seen a variance of capacity. many countries are not able to implement these particular flexibilities into their national jurisdictions for various reasons. It may be the application of a particular type of legal regime. It requires amendments to national legislation. It requires all of these capacities. It requires a well-functioning IP system. Many of our members don't have that. Many of our members have understaffed IP offices, understaffed IP institutions that are not able to really fully implement these particular flexibilities. And so from that point of view, these flexibilities, even in the best of times, are very hard to access. But in a time of crisis and pandemic, it makes it even more difficult to implement and access them. So Article 31 and Article 31 bis, are particular examples of some of the flexibilities that would be applicable in the TRIPS agreement. But nonetheless, so under these circumstances, these flexibilities are very hard to invoke. There are requirements in terms of processes, notifications, and the issuance of particular types of instruments or compulsory licenses, if that were the case, that are subject to a whole lot of conditionalities. And so from that point of view, it's very difficult to imagine any developing country that already has a lack of capacity to use these effectively in a time of crisis. And so from that point of view, the waiver proposal really lifts all of those impediments and allows a country to assess what its needs are, and also to access what is available on the international market without IP being a barrier. And so from that point of view, we believe that this is a timely and necessary initiative that will allow members to really address access issues in a very real and concrete way. In addition, given the limits of what can be achieved through these voluntary mechanisms such as ACTA and COVAX per se, I also just wanted to share that funding has been a perennial problem. So at the moment, there is some funding requirements to ensure that the vaccines, the therapeutics and diagnostic pillars of this initiative receive enough funds. And if I could just read, so the total amount which has been committed so far has been 5 billion. And this is alongside the 4.8 billion COVAX self-funding participants and the down payments that would have been received to support the facility for manufacturing and procurement for all COVAX participants. Now, what is quite apparent is that an additional 4.3 billion is urgently needed, with a further amount of 23.9 billion required for 2021, if the tools are to be deployed across the world as they become available. And also, these funding requirements sit against the ACT Accelerator's total budget, which is around 38.1 billion. So we can see that there's quite a large funding gap that has not been closed. And so one of the concerns that we have is that we will not close the funding gap. And as a result, the promises of delivering on the various pillars may not be realized. So I hope that kind of gets to the question that you posed.
It does, and as we actually like round up, there are two questions that I have. One is, the thing that is recurring in my mind, and I'm sure in the mind of many listening, is what about this age-old argument that the reason you have intellectual property, IP rights in place is you want to get that right balance between spurring invention and innovation by these very pharmaceutical or medical or scientific sort of communities and incentivize them to produce, but at the same time make these inventions that in this case are life-saving available to as many people as possible. And so your proposal in a sense puts that a little bit out of whack, because in the future, in future pandemics, even in this pandemic, you may not, with this proposal and let's say suspension of IP rights for a fixed period of time, you are doing damage to that very balance that is the basis for having intellectual property rights systems work inevitably for the entire world. That's my first question. And I've heard some of these sort of criticisms come up in the context of the TRIPS Council meetings that you have proposed this waiver to. And then I guess the second and final question is, knowing where you are now in the process of the proposal and the waiver, what is left to do? What is the process at the WTO for getting your waiver approved by other proponents, including the Caribbean? I'm sure you're courting the Caribbean. And where ultimately would this process go in order for it to be successful?
Yeah, Genevieve, two very, very important questions. And I think, you know, one of the issues would be that, yes, innovation is a product of this agreement that we have, that anyone that is innovative should disclose this information to humanity, and in recognition of this disclosure, the innovator will get some monopoly rights. However, this monopoly right, IP as a phenomenon, is not absolute. We have a recognition in the TRIPS agreement, Articles 7 and 8, that we need to balance these rights. And so it is not unusual for states to limit the rights of right holders in situations of extreme urgency, in situations of pandemics, in situations of national emergency. So we want to debunk this idea that the mere limitation of IP rights will invalidate investment and innovation down the line. This has not been the experience, even in jurisdictions where compulsory licenses are issued in a more routine way. You can look at the USA, you can look at recent examples in the European Union, and even further afield, you will see that the necessary limitation of these rights do not necessarily correlate with you know, a disincentive for so-called innovation. I also want to point out that a lot of the innovation that we see around vaccines, therapeutics, and new technology that is emerging during this time of COVID was actually a result of public funding. A lot of these interventions come from state funding, either directly or indirectly, collaborations within higher education institutions. And so the commercialization is given to a private company that has invested very little in the final product, but gets the right to say at what price this particular product will be sold, whom it would be sold to, and in what quantities. And so from that point of view, I think that these arguments are overblown. If you really just look at what is happening on the ground, it is not IP necessarily that has resulted in these astounding successes, but it has been the collaboration of ordinary people, the time and effort by scientists working in higher education institutions, state funding, that has substantially underwritten the types of innovation that we see. And so states should take a position that any product or a technology that benefits from state funding should have some strings attached. This is why people are calling for a citizen's vaccine, a vaccine as a public good, because states have had a huge role in many of the successful candidates. So I'm going to leave it at that, but just to say that I don't think that the argument that limiting IP rights under these circumstances will necessarily lead to less innovation in the future. So on the way forward, very quickly, Genevieve, we've had a very good discussion today, and this matter will go to the General Council for further consideration. Given the fact that we still have some matters to further clarify and discuss, we will continue this discussion in the TRIPS Council until the end of January, early February, and then we would certainly have to make a decision about how we deal with this particular matter. But I can confirm that the waiver proposal has garnered essentially overwhelming support, even in today's session. But we would also see from a lot of interventions and activities by civil society, international organizations, that that everyone is of the opinion that this particular proposal will make accessible all of the technologies and products necessary to address COVID-19 in a short and effective way. And so a parting shot from my side is that any of the Caribbean member states should necessarily look at this situation and lend their voice to supporting this waiver proposal, including through sponsorship through the ACP group in Geneva. This sends a very important political message. It also underscores many of the points that that delegations from the Caribbean have been making for the longest time. The mere fact that you are classified as a middle or upper echelon income developing country should not be the sole reason why more obligations are shoved onto you. If we look at the structural differences between CARICOM members and other members in the developing world, we see that their classification is really spurious, because if you look at health infrastructure, if you look at debt to GDP ratios, if you look at private household debt, if you look at out-of-pocket health expenditure, most of the members in CARICOM are on the upper end of those scales, which means that the situation that many of the members find themselves in is precarious. And so to mitigate any negative impacts, I believe it is responsible for governments of these member states to look at the situation closely and to make the right decision. And that decision is to co-sponsor and join calls for the waiver to be agreed, so that we can ensure access and equitable and timely access if that is the case. And it will also allow us to build more securely for any future pandemics, because if past pandemics are anything to go by, we've not dealt with them properly. We've not put the infrastructure in place. And so the message to governments is also to really invest in the type of infrastructure that will help us to weather future pandemia. And they're coming in a big way. I think the Caribbean is also exposed to other external factors such as climate change. And we've seen from the last few seasons how many of the economies are being affected. So part and parcel of this is that it is not only a health crisis, but it is also a crisis that requires coordination at every level of government, society, and certainly at the level of international organizations.
Well, thank you so much for what can only be described as a spirited initiative by you and your co-sponsors, and on this forum, a spirited cry for the Caribbean countries to support that proposal. You've certainly set down all of the prerequisites for understanding the genesis as well as the objectives of the proposal and the path forward. So we at the SRC will be watching very closely to see the twists and turns of the proposal and see ultimately where it goes. Best of luck with it. And from our part, we may yet ask you to come again when it gets to a stage where I guess the General Council will be seized of it and ultimately have to decide on whether that waiver, which requires a 3/4 majority, will pass and will then make accessible to to all countries, developed and developing countries, all of these benefits of equipment, vaccines, medicines that will make the lives of all the world's citizens more bearable in the throes of this pandemic. So, Mustaqeem, thank you so much for your time. Good luck with the remainder of the proposal, and we look forward to having you here on one of our SRC chats or one-on-one chats again. Thank you so much for your time.
Yaniv, thank you very much, and thank you to the Center for having me. I think these are important discussions to have, and hopefully there are many other topics of interest that one could be invited back to discuss.
Thank you so much. And to everyone, enjoy your Christmas season, and we hope to see you. This is the last of our events for the year. We hope to see you again next year. Thank you. Bye-bye.